This health issue involves inflammation in the joints and can be a debilitating problem. Hi, I'm Rebecca Brayton and welcome to WatchMojo.com. Today we're at the Montreal Children's Hospital to learn more about arthritis and how to manage it on a day-to-day basis. What is arthritis exactly?
Arthritis is a group of diseases where there's inflammation in the joints. So the first part of the word, arth, means joints, and itis at the ends mean inflammation.
What causes it?
There's about 100 kinds of arthritis, and so every type of arthritis is different, so it's hard to speak about the particular cause, and at this point in time we don't yet understand fully what causes this disease or this group of diseases.
What are the most common types of arthritis?
Osteoarthritis is more common, I would say, in the elderly population. It's caused by premature aging of the joints, but there's other types of arthritis that are less frequent but can be quite severe in some patients, like rheumatoid arthritis in the adults, and there's also juvenile arthritis in children.
What symptoms should we look for?
The main symptoms are pain in the joints. There's also fatigue, and there's stiffness, which is usually present in the morning after patients wake up. They feel stiff after having slept all night in the same position, and then they get slowly better as the day progresses.
How does it affect a person who is suffering from it?
Arthritis can affect the life of people in so many different ways. People who are work, it can make the work environment more difficult. Sometimes we need to have the work adapted for the patients living with arthritis. Sometimes patients can find difficult to also work 5 days a week because they feel so tired by the end of the week. Kids with arthritis can also find it difficult to attend school or to learn how to write and so on. Participation into sports is also challenging for patients living with arthritis, and it can also lead to social isolation, because when you're in pain and you're feeling tired, you don't necessarily feel like seeing your friends or going out. You feel more like staying at home.
How serious can it be?
Every patient is different. Some patients have mild form of diseases, but some patients, it can get serious to the point that some patients can become physically disabled with joint deformities and even requiring sometimes joint replacement.
What kind of therapy is best for treatment?
We use a combination of therapies. So there's the medications that are really important to control the inflammation and prevent damage, but there's also physical activity. So physiotherapy and occupational therapy, which involve exercises that are specifically adapted for patients living with arthritis. In situation where it's an inflammatory arthritis, so like rheumatoid arthritis or juvenile arthritis, we use anti-inflammatory medications. We use immunosuppressive medications that will control or suppress the immune system to really control the inflammation. And that has two goals. The first goal is to maintain the quality of life of the people affected, but the second goal is also to prevent long-term damage.
Is there anything we can do to prevent arthritis?
We don't precisely know what causes arthritis, so it's hard to predict who will get arthritis. But for example, for osteoarthritis, one thing that can, I think, help to prevent the development of osteoarthritis is to be careful with weight gain.
What activities should we avoid? Are there any activities that can aggravate the condition?
In general, exercise is excellent for people living with arthritis, but it has to do with choosing the right exercise for each person. There are exercises clearly that could aggravate the pain of a patient, so it has to do with how much you do of the exercise. There are clearly exercises that are good for people with arthritis, for example, swimming, because there's no impact on the joints while you're in the water. Biking is also good. Walking is excellent as well.
Thank you very much.
Thank you.